I guess that's it. We're live. So this is such a surreal experience because I've been wanting to do this for probably over a year. Um, Thinking about how much value I've gotten out of other people's podcasts or blogs, stuff that people have written. And so I don't know. I don't know how it's going to go. It's interesting, even just hearing cars in the background. I don't know if the audio is going to be good, or I got recording equipment, and I'm just decided to just sit down in front of my laptop with my built-in camera and microphone because starting is the only way to start, I guess. So I don't know what I'm going to talk about. Maybe it's a good place to start of who I am. My name is Shane. I'm a nurse. I live in Michigan. I started nursing in 2013. I worked in critical care area for 7 years, mostly neurological patients, stroke patients. And I had a wonderful time nursing. And then I got burnt out pretty quickly, relatively quickly. And inside of the burnout, it really put a contrast on the care that I was delivering at a high level and what I actually felt inside. And those thoughts are something that I feel like need to be shared because it's a more common experience than people want to admit to. So I'm writing a book, and the book is about patient experience and what healthcare looks like from multiple different patient lenses. And so in nursing, there's this thing called the DAISY Award that's put together by the DAISY Foundation. And it's just a simple award that patients can recognize their caregivers for an exceptional experience. And they write a letter for a nomination describing a little bit of their story and why they felt whatever the nominated caregiver deserved it for. Kind of a cool thing to dedicate, to say thanks to somebody who made a bad situation a little bit better. So through my nursing career, I was nominated over 19 times to have one of these awards. I think it's relatively a lot. It's not something I really was fond about talking about when I was nursing, just because that's not what I was there for. I just clocked in like everybody else, and my goal wasn't to get an award. I just cared for people the way I cared for people. But going back and reading those nominations, I think it's important to highlight some common threads, because then we can articulate out something there, that there's some sort of, something that's outstanding that people really come to respect in their healthcare that they receive. And you can theorize it about in all these nursing textbooks, medical psychology, about what motivates people and what the right actions are and what the right things to say are, and open communication, and all these hot topics, hot takes on delivering a positive experience. But when it comes down to it, it's something much more than that. It's much simpler than that, but the meaning is much more. So that's my goal with the book that I'm writing. And anyway, I hope that somebody can get something out of it. So, staying here 1 second. So I figure maybe I'll just start reading a little bit of what I had here. I was going to start every chapter with one of these nominations, and then kind of go through an analysis of what I thought was important and what led my actions. The book's called The Daisy Experience. Chapter 1 is called The System as Leverage. The nomination goes as follows. Shane made a very scary and stressful time for our family an essentially pleasant experience. My mother, Mary, the names are redacted by the way, suffered a very bad stroke and was brought to 4 Heart ICU. Shane immediately introduced himself and made himself available for questions, and then went to work caring for my mother. The level of care was amazing. He demonstrated and exemplified a level of care and compassion in his work few have ever matched at any hospital we've ever been to. He listened attentively, constantly checked in on both my mother and our family who had sporadically arrived. His care was genuine and compassionate. We've dealt with hundreds of doctors and nurses and care staff during my mother's illness, but nothing has ever stood out for our family as much as Shane has. It is hard to put it into words, but his care, compassion, attention to detail, the patience, and overall professionalism and personable demeanor, beyond exemplary bedside manner, reflects great credit upon himself and the Spectrum Health system. I would hope, if ever the need, to have a nurse even half as good as him. Again, it feels really strange reading my own nomination, especially publicly, in like a boasting kind of sense, but I hope that I can get past that soon, because I do think there's a lot there. The first line in this letter accurately sums up exactly what my unconscious goal was when providing care to all critically ill patients. Nobody comes to hang out in a critical care area because they want to enjoy their experience. Although there are some elective procedures that would land you in a care area for close monitoring, our customers largely did not choose us, or by extension, choose us to take care of them. There are a few other circumstances in our cultural market that the consumer does not get to choose where they go to receive something that they need. There was one time that my car broke down on the way to work. When I called the tow truck for help, I was given a single option for an auto repair shop. In a way, I felt even more trapped than what I already was in a bad situation. Starting at the system level is a logical place to start when trying to comment on why a patient had a good experience. Large hospital systems provide enormous resources that benefit the community at large, not least of which is the comfort value added when someone lands in the critical care area of one of these large hospital systems. To me, the reputable system is a necessary prerequisite for a patient to go from a very scary and stressful situation to an essentially pleasant experience, as they noted. Although the nomination names me, Shane, as the subject of the verb made, I could only ever act under the structure of the system. And it's important to highlight. I've not worked for any other hospital system, but I would venture to say that if I did, with the same patient encounters, my perceived care would not have been nearly as efficient. If actions and care are not efficient, especially in critical, life-threatening situations, you can forget about providing a positive patient experience. This family even alludes to the fact that when they say that my care reflects great credit upon myself and the Spectrum Health system, the individual is only perceived as efficient as the system in which they are operating. If you take the inverse of this, the system is only as efficient as the individual's actions. It's also true. So when the system and the individual are working in synchronicity, that the product is a great experience. In this way, I was intentionally leveraging the system. People that know me also know that organized structure is not what I do well. Fortunately enough, a lot of the organization work involved delivering disease-specific care that's already been done and continues to be done behind the scenes by process improvement and medical treatment model approaches. These treatment models were analogous to a vinyl sticker. All that I would have to do as a nurse was peel and stick with a smile on my face, and then to engage in a genuine curiosity about the patient and the family and what brought them there. Of course, this is an extreme oversimplification of the work that's done, especially in critical care areas, hospital areas in general. But the point is, if the patient really perceives their care is as simple as applying a sticker and that the person providing the care has clearly applied many stickers before, then what would the reader worry about? The answer is the only thing, the unknown. Remember that this patient arrived unexpectedly, by no choice of their own. Their ordered structure of reality goes from initially planning a trip to, say, the grocery store, to buy vegetables that they don't need, because the ones in their fridge are already rotten. And then immediately it goes to chaos, something they can no longer control. This patient and family needed a dose of simple. Imagine that the situation that this family fell in to be a deep hole in the ground. At that point, they did not need to know what the dimensions of the hole were and to establish a step-by-step process of how to get out. Although this is what the patients and their families always default to by human nature. What they needed most was for a competent professional to climb down in the hole with them so that a tragic situation doesn't also become a lonely situation. My message was this: the system gave me a rope and I know how to use it. It isn't going to be an easy climb and it's going to be stressful to everyone involved, but I have a rope. Yeah, Hayes.